Hello, this is Elizabeth Fletcher, and I will be talking about the causes of long-term cocaine exposure on the decision-making process, specifically with impulsive choice. Okay, so drug abuse and addiction are associated with a range of cognitive and neurological deficits, including impulsive decision-making that is covered in this video. Impulsive decision-making is basically the selection of small short-term gains, such as the feeling of the drug immediately, over larger, longer-term gains, such as employment or family, and this may be related to the inability to assess long-term consequences in one's actions after they've had a prolonged exposure to drugs. Okay, so the researchers of this journal touched base on the fact that despite there is strong association between drug addiction and increased impulsive choice, the direction of causation between these two things still are pretty unclear, even though there's data to back up this hypothesis, such as animal models that showed repeated exposure to drug abuse produces an acute enhancements in impulsive choice. But there are also other factors to consider, such as maybe having a pre-existing impulsivity behavior before someone takes drugs or anything of that nature, basically. The abnormal levels of impulsive choice in drug addicts can be exposed through personality inventories and laboratory tests, which we will see here soon. The major concept that is used throughout this article and in experiment is delay discounting, which is the manner in which rewards decrease in subjective value in proportion to the delay preceding their delivery. This is the measure of impulsive choice in both animals and humans. Basically, in other words, someone not wanting a reward because it takes too long to receive it. All subjects consistently demonstrate some degree of this delay discounting concept, but there is a larger increase when someone is exposed to drugs. Okay, so the subjects of this experiment were 16 male rats, all within the same range of weight. All of them were individually housed in these quarters with the same daylight cycles, and all of them were given free access to food and water. Okay, so the testings were conducted in 4 identical rat chambers. There is a variable group and a control group. The variable group consisted of 8 rats that were injected with the same amount of cocaine over the course of 14 consecutive days. Then there was a control group that consisted of the same amount of rats as well, but this time they were injected with saline solution over the course of 14 consecutive days. After the administration of either saline solution or cocaine, they were then monitored for their locomotor activity, and then after that there was a 3-week withdrawal period with both groups. So upon completion of the 3-week withdrawal period, rats were reduced to 85% of their free-feeding weight over the course of 5 days and were maintained at this level throughout the duration of behavioral testing. In addition to that, each test chamber was equipped with a recessed food pellet delivery trap, fitted with a photo beam in order to detect their head entries every time they entered the trap. Also, before they started this behavioral testing, each rat was given 5 food pellets in its home cage to reduce any neophobia to the food, basically just in case if they were scared of the food during this process. So the rats were then shaped to either press a right or left lever in order to get food pellets to come out of the trap. After they were shaped with this lever pressing, they were shaped to nose poke in order for a lever to come down so that they can press it. After that, the delay discounting test was conducted. So with this delay discounting method, the rats were shaped to either push a right or left lever. The right one was an immediate response of food, and then the left one was a more delayed response. And this delay went up to 10, 20, 40, and 60 seconds of a delay. Okay, so the cocaine-exposed rats demonstrated higher locomotor activity compared to saline-exposed rats. The delay discounting test showed no difference in lever presses, omitted trials, or food trip responses between these two groups. The preference for large reward lever decreased as delays increased, but the data showed that cocaine-exposed rats chose the large delayed reward less frequently than saline-exposed rats did. Okay, so the data showed that cocaine-exposed rats do indeed display an increased preference for small immediate rewards. It also showed that cocaine is sufficient to cause long-lasting increased impulsive choice behavior, and this increased impulsive choice may be a result from impairment in leaking responses to outcomes over long delays. This data is also consistent with humans as well as animals. So to conclude this video, the results of this experiment clearly demonstrate that cocaine exposure has long-lasting consequences on the neural function.